Good evening, everybody. I'm Sayukta, your host for today's live from All About Skin Allergy Tea. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some point of time in our lives. Urticaria is characterized by a round rash on the skin that itch a lot. It may be due to the chemicals present in certain food items, allergy to certain medications, insect stings, sunlight, and sometimes the cause is even unknown. As per study published in Indian Journal of Dermatology, Venereology and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can actually worsen your symptoms. Consult your nearby qualified skin specialist immediately for an early revision. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, kind of test required for its diagnosis, the right treatment and management approach for an early relief. So today we have with us consultant dermatologist Dr. Bhawna Bhuraria live from Rewari, Haryana, talking about urticaria and its management. Dr. Bhavna is a dermatologist. She has 11 plus years of experience in this field. She has completed her MBBS from Maharshi Dayanand University, Rohtak in 2010 and MD Dermatology, Venereology and Leprosy from Dr. B.R. Ambedkar University, Agra in 2016. She is also a member of Delhi Medical Council. And today we are going to talk about urticaria and its management. A very warm welcome to you, Dr. Bhavna Bhuraria. Hope you are doing good, ma'am.
Yeah, hi Sayukta and hello everyone. So today our topic of discussion is urticaria.
Yes. Yes, doctor, and we would like to understand in the beginning what urticaria is. What does it mean?
So urticaria is a very common skin condition. So it presents as red bumps or pale white bumps on the skin or swelling of the skin. And in most of the cases, it is associated with the intense itching, and in some cases, it may be associated with the burning sensation.
ओके एंड जैसा कि हमने शुरुआत में बताया डॉक्टर कि अर्टिकेरिया बहुत कॉमन होता है कई लोगों को ये होता है 1/5 of the population a report says have or had urticaria at one point of time ऐसे में हम ये भी जानना चाहेंगे कि आखिर ये होता क्यों है
There are different reasons for the urticaria. So it can be an allergic reaction to the food, and this is the most common cause of urticaria. And it can be allergic reaction to some infection or insect bite, mosquito bite, insect stings, or some. It can occur after some medications also, like NSAIDs. In layman language, we can say anti-inflammatory or painkillers. Certain antibiotics can also lead to urticaria. In food, the main food that are responsible for causing urticaria are eggs, nuts, shellfish, and certain other food preservatives and additives in the food. They can also lead to urticaria. And then other reasons are also there, which are not very common. So they are mainly associated with the chronic urticaria. Chronic means when the duration of the disease is more than 6 weeks. जब 6 weeks से ज़्यादा disease चलती है, तो उससे पहले हम उसको acute बोलते हैं. But if it lasts for 6 weeks or more than 6 weeks, then we call it chronic. So chronic urticaria can be associated with other things also, other diseases like chronic infection and some other internal diseases, autoimmune diseases. So these are the main causes of urticaria.
Right. So we can say n number of things can cause urticaria. Now, for a better understanding of people, of our viewers who are laymen, who are not very technical about these things, right? We would like to understand how does urticaria look like? Because normally बहुत सारे skin allergies होते हैं, skin reactions होते हैं. तो अर्टिकेरिया जब हो तो कैसे हम कैरेक्टराइज उसके कैसे कैरेक्टरिस्टिक्स होते हैं कि हम बता सके कि हाँ ये अर्टिकेरिया है और अब हमें डॉक्टर की सलाह लेनी बहुत जरूरी है.
Urticaria usually presents as hives or wheals. So हिंदी में हम कह सकते हैं कि जो स्किन है वो थोड़ी swollen हो जाती है, रेड बम्प्स और पेल वाइट बम्प्स हो जाते हैं स्किन पे. तो हम उसको ऐसे पहचान सकते हैं. और वो बम्प्स कई बार इंडिविजुअल होते हैं एंड समटाइम्स दे आर इंटरकनेक्टेड टू फॉर्म अ लार्ज स्वेलिंग और व्हील. सो जनरली वो ऐसा दिखता है एंड इन मोस्ट ऑफ द केसेस इट इज एसोसिएटेड विद सीवियर इचिंग. तो बहुत ज्यादा जब वो इरप्ट होता है तो बहुत इचिंग होती है, उसके बाद भी इचिंग परसिस्ट करती है और कुछ लोगों में बर्निंग सेंसेशन भी फील होती है जब बम्प्स होते हैं या व्हील्स होते हैं. और यूजुअली इट लास्ट फॉर फ्यू आवर्स एंड मैक्सिमम अप टू 24 to 48 hours.
ओके. ये भी डॉक्टर आपसे जानना चाहेंगे कि ये कितना सीरियस है. हाउ सीरियस कैन अर्टिकेरिया बी?
As such, urticaria is not a very serious condition, but in some cases, when it is associated with the swelling of the deeper layers of the skin. So, urticaria usually involves the upper layers of the skin. But when it involves the deeper layers of the skin, we call it angioedema. So there's a different word for that swelling. So we call it angioedema. It can involve eyes, lips, genitals, and it can also involve internal organs like lungs. When it involves lungs, it causes shortness of breath or difficulty in breathing. And it can also involve our gastrointestinal system. In that case, it can lead to abdominal pain, severe abdominal pain, or diarrhea. As such, short attacks of urticaria are not life-threatening, but if it is associated with angioedema, and if it is angioedema only, then it's a life-threatening condition if it involves the internal organs. And if an individual experience such symptoms related to the angioedema or severe urticaria, then they should immediately consult a nearby dermatologist to get treatment on time.
Okay. So in general, urticaria is not life-threatening, but in case there is swelling of whatever organs you just mentioned, then one should not waste any time and go and consult a doctor. क्या इसमें ये कहना भी लाजमी होगा डॉक्टर कि मान लीजिए आपको अर्टिकेरिया हो रहा है, आपको नहीं पता ये क्या है, आप कंटिन्यूअसली इच कर रहे हैं. एक नॉर्मल ट्रेडिशन होता है हमारी सोसाइटी में कि हमको कोई भी स्किन रिलेटेड एलर्जी होती है या किसी तरह की परेशानी होती है तो हम या तो ओवर द काउंटर मेडिकेशन कोई एंटी एलर्जिक ले लिया या होम रेमेडीज की तरफ जाते हैं. वी वेरी रेयरली गो एंड कंसल्ट अ डॉक्टर, राइट? तो ऐसे में अगर हम अपनी कंडीशंस को इग्नोर करते रहे एट द वेरी बेसिक लेवल्स, तो हो सकता है वो आगे जाके बहुत सीरियस हो जाए. इसलिए क्या आप ये एडवाइस करना चाहेंगे कि शुरुआत में ही डॉक्टर को दिखा लेना अच्छा है?
Definitely. One should never do self-medication. Even if the disease is mild or benign, you should consult a doctor so that the medicines can be started at the right time, and we can prevent the further complications associated with the disease. So by doing that, we can arrest the progression of the disease. Also, we can find out the underlying diseases or reasons also which are leading to the urticaria. So definitely हमें कभी भी खुद से मेडिसिन नहीं लेनी चाहिए, हमेशा हमें ये अवॉइड करना चाहिए. चाहे माइल्ड भी है, definitely you should go to a doctor, and then हम कुछ टेस्ट कर सकते हैं, cause find out कर सकते हैं, and then we can start the medicines immediately.
Right. As you said, it's important to understand what has caused urticaria, right? So it's important to diagnose the cause. Now, my question is, what do you as a doctor do when a patient comes to you to find out the causes, etc.? फिजिकल एग्जामिनेशन और टेस्ट या सिर्फ बात करके हिस्ट्री से ही आप पता कर लेते हैं, क्या प्रोसीजर होता है डॉक्टर?
When a patient comes with the urticaria, so first thing is the history. History is very important to rule out the reasons and or causes, and then the physical examination. Definitely, we want to be sure whether it's urticaria or something else or some other rash is there. So physical examination is very important, and history also. And then if required, then we can also do certain lab tests or investigations to rule out the chronic causes of urticaria. Or if it is acute, then also if the condition of the patient requires, then definitely we should go for certain investigations.
Okay. You also mentioned about acute and chronic urticaria. आपने बताया कि जो 6 वीक तक रहे और ठीक हो जाए वो acute है, उससे ज्यादा अगर वो लेता है तो वो chronic हो जाता है. We would like to understand chronic urticaria a little more, and also would like you to shed more light on how does it goes away. Does it ever goes away permanently?
So if the condition lasts for more than 6 weeks or at least for 6 weeks, then we call it chronic urticaria. And in chronic urticaria, patient may experience hives or symptoms of urticaria daily or almost daily. So a chronicity is there, and it's a chronic condition, so it may last for a few months, and in some individuals it may last for years also, and this can go on like this. And in some cases, definitely, if the cause is there, then we definitely try to treat it. But in some cases, we are not able to identify the particular cause. So in that case, we should give the medicines, and uh, uh, will try to treat it with the medicines. But in some cases, it can go away spontaneously also by itself.
Okay. So it may take a lot of time, or it may just, vanish with very less length of treatment.
May take time.
Yes, right. We would also like to know what are the potential complications of urticaria if left untreated.
As I said, angioedema is one of the very potential complication of urticaria. If it involves the deeper structures or layers of the skin or internal organ, it can definitely lead to a life-threatening condition. So this is the one of the most dreaded and common complication of urticaria.
Now, with whatever symptoms you have told us about urticaria, I can imagine that how much frustration or irritation or discomfort a person with this urticarial condition goes through, because he or she is continuously itching. Many times people avoid going in public or in social, functions, etc., because they feel that they'll end up in a very embarrassing situation. And that definitely causes a lot of stress. Now, my question is this stress going to exaggerate or aggravate urticaria even more?
Yeah. So urticaria is also a psychodermatological disorder. So stress can definitely lead to the onset of the urticaria, and it can also lead to increase the severity of the disease. So stress plays a very important role, and one should avoid the stress associated with the disease. I know it's a little difficult for the patient, but one should try to avoid the stress.
Exactly. And it's important to understand that it's treatable. There are medicines available, or there is a treatment line of treatment. So one need to go share their problem with the qualified dermatologist and start the treatment, and not just suffer in silence, because many people does that. अर्टिकेरिया के केस में ये बहुत होता है कि कंटिन्यूसली इच कर रहे हैं या ओवर द काउंटर एंटी एलर्जी एलर्जेंस ले लिए हैं, और एक स्ट्रेस में तो है ही, लेकिन डॉक्टर के पास हम बहुत बाद में जाते हैं और तब तक हमें लगता है कि बहुत वक्त जाया हो गया, अगर पहले जाते तो बहुत आराम पहले ही मिल जाता। तो अगेन वी वुड लाइक टू अवेयर आवर व्यूअर्स अबाउट इट। Please go and consult a qualified dermatologist in case you have urticaria, any symptoms associated with urticaria. कई बार लोग ये भी कहते हैं, they often complain, you know, that their hives or urticaria get worse during night. What's the reason behind that, doctor?
It may be because of the reason that the patient may be coming in contact with the trigger close to the bedtime, or it may be because of the something that the patient had in the dinner, or some medicine then that the patient take at bedtime. It can be due to the due to allergy uh, due to the allergy of the nightwear, fabric of the nightwear, or the bed sheets also. So I mean, the trigger is related to the that time, or the activities that the patient are doing during the night time or bedtime.
Exactly. And does urticaria makes a person tired, fatigued?
Yeah, definitely. Urticaria is a chronic condition. It is related to the itching. In some cases, it is related to the intense itching. So it has an impact on the overall quality of the life. It can lead to reduced quality of life of the patient because of the reduced sleep also, or disturbed sleep also. And fatigue itself is a very common symptom of urticaria.
Mhm. So definitely, I mean, again, a patient goes through a lot of stress, discomfort, and the only way out, the only way to stop or get out of that vicious circle is to consult a qualified dermatologist. Now, doctor, as we have also discussed that, you know, when urticaria or any other skin reaction, skin allergy, skin condition arrives, we normally run inside our kitchen to find a home remedy or a home fix, or we go over the counter to get something to fix it. Now, first of all, we would like to talk about the home remedies. ये जो home remedies हम करते हैं, especially urticaria के केस में, कई लोग एलोवेरा प्लांट को काट कर उसमें से उसका जेल निकाल के लगाते हैं, या दूसरे कई उपाय करने की कोशिश करते हैं। ये कितने सेफ है?
Aloe vera as such has soothing qualities, so it acts as a calming agent. So, but the role of aloe vera is just external. It doesn't have to do anything with the causation of the urticaria. So we should always consult a doctor to find out the cause. Identification of the cause is very important in treating the urticaria.
राइट। और जैसा आपने कहा, जब आप कॉजेस बता रहे थे कि किस किस वजह से अर्टिकेरिया हो सकता है, आपने कहा एलर्जीज होती हैं, बहुत सारी तरह की एलर्जीज होती है, तो हो सकता है हम जो एज अ रेमेडी लगा रहे हो अपने ऊपर, उसकी हमें जानकारी ही नहीं है, हमें नहीं पता उसमें क्या है, क्या उसका कंटेंट है, और हो सकता है हमें उसी से एलर्जी हो और हम अपनी कंडीशन को और ज्यादा खराब कर बैठे। तो इसलिए भी बहुत जरूरी है कि हम डॉक्टर को दिखाएं। द सेम वे आई वुड आल्सो लाइक टू अंडरस्टैंड हाउ बैड ओवर द काउंटर ट्रीटमेंट कुड बी। एंटी एलर्जेंस के बारे में लोगों को बहुत पता है, हमारे यहाँ बहुत इजीली ओवर द काउंटर मेडिकेशन हो जाता है, मिल जाती है दवाइयाँ बहुत आसानी से, और हमको सबसे इजी यही लगता है कि जाओ केमिस्ट से पूछो, एक एंटी एलर्जी दे दो, हमको स्किन एलर्जी हो रही है, हमने ले लिया, सो गए। हाउ बैड दैट?
The dose of the anti-allergic medicines should always be consulted with a doctor. अगर पेशेंट जाकर ले भी रहा है ओवर द काउंटर मेडिसिन, तो एक तो उसको मेडिसिन की नॉलेज नहीं है, then he doesn't know about the dose. And when they take over the counter medicine from the chemist or from some other source, then they take it irregularly, or they take it only when they have the symptoms.
Right.
So ideally it should not be done. If somebody is having an attack of urticaria, acute or chronic, there is a course of anti-allergic medicines that helps in suppressing the allergic response. Once that course is over, then you can take medicines on SOS basis or on when required basis.
Right.
So it should not be done over the counter medication or self medication or using home remedies without having the proper knowledge of that treatment. It should not be done by anyone.
राइट और ऐसे भी एंटी एलर्जिक जब एलर्जेंस जब हम लेते हैं कई बार उनसे बहुत नींद आती है, सेडेटिव होते हैं उनमें, या हमको नहीं पता होता है, जैसे कि आपने कहा कि कितना डोज में लेना है, कब तक लेना है, कब लेना है, कब नहीं लेना है, तो बहुत खतरनाक हो सकता है। मान लीजिए कोई ड्राइवर है, उनकी जॉब ड्राइविंग है, उनको नहीं पता, उन्होंने ओवर द काउंटर मेडिसिन ले लिया एंड द होल व्हाइल व्हेन ही और शी इज ड्राइविंग, he or she is sleeping, which can be actually very dangerous and fatal for your life.
कॉन्ट्राइंडिकेशंस होते हैं मेडिसिन के, किसमें कौन सी मेडिसिन देनी चाहिए, जॉब प्रोफाइल के अकॉर्डिंग दिया जाता है, ऑक्यूपेशन के अकॉर्डिंग दिया जाता है। फिर कुछ कॉन्ट्राइंडिकेशंस होते हैं, जैसे कुछ इंटरनल डिजीजेस हैं, कार्डिक पेशेंट्स हैं, रीनल पेशेंट्स हैं, सभी मेडिसिन का अलग मेटाबॉलिज्म होता है, उनका एक्सक्रीशन अलग होता है। सो ये चीजें सब ध्यान में रखनी होती हैं, एंड ओनली अ डॉक्टर कैन डू दिस जॉब। सो self medication and OTC medication should be avoided.
एक और बहुत ही आसान प्रैक्टिस होता है कि हमारे किसी फैमिली या फ्रेंड को अगर हुआ हो तो उनसे पूछ लो कि उन्होंने क्या किया था। अच्छा तुमने ये क्रीम लगाई थी, अच्छा तुमको डॉक्टर ने ये प्रिस्क्रिप्शन दिया था, मुझे भी दे दो, मैं यही लेकर आ जाती हूँ एंड यू नो आई विल बी फाइन। ये कितना ज्यादा डेंजरस होता है। अगेन कीपिंग इन व्यू कि आपने कहा कि कॉज पता करना बहुत जरूरी है, तो कॉज तो अलग अलग हो सकते हैं। जैसे मैं अगर किसी और का प्रिस्क्रिप्शन मैं लेकर और उस तरह से अपना ट्रीटमेंट करूं, वो कितना खतरनाक हो सकता है।
Yeah, definitely. This is a very common practice, especially in India. So ये बहुत खतरनाक हो सकता है, because हर एक की मेडिसिन अलग होती हैं, वो डॉक्टर ने किसी रीजन से पेशेंट को दी होती है, एंड इट्स अकॉर्डिंग टू द कंडीशन ऑफ द पेशेंट, एज ऑफ द पेशेंट, हेल्थ ऑफ द पेशेंट, and dose is also according to the weight of the patient, age of the patient. So everything is different. So ideally it should not be done.
Exactly. And doctor, is there any dietary precautions or do's and don'ts for the patients of urticaria? क्या खाना चाहिए, क्या नहीं खाना चाहिए?
Yeah, certain food items like I have already mentioned, eggs, nuts, certain chocolates, then soya milk and berries, tomatoes, especially cherry tomatoes. So they are the most common food items that are prone to cause allergy or urticarial rash. So in a patient of urticaria in general should avoid eating these food, and but then again allergy depends from person to person. Some individual they are allergic to some food and some are allergic to some food, so that has to be ruled out, or that the cause or the particular food item that the patient is allergic to, it should be like it should be avoided by that patient.
Right. And many times what happens, there are a number of people who understand or know what they are allergic to. किसी को सी फूड से एलर्जी है, जैसा आपने बताया, चीज से है, एग से है, जिससे भी उनको पता है तो वो उससे अवॉइड करते हैं। कई लोगों में एलर्जी बहुत बाद में डेवलप होती है, अभी तक उन्हें अंडे से कोई एलर्जी नहीं थी, लेकिन सडनली उन्होंने देखा कि मैंने पिछली बार अंडा खाया था तब भी मुझे प्रॉब्लम हुई, इस बार खाया तब भी मुझे प्रॉब्लम हुई। तो इस तरह से ट्रैक रख पाना, क्योंकि कुछ चीजों में तो ट्रैक रखना इजी होता है, आप समझ सकते हो, अच्छा ब्रेकफास्ट में मैं जब अंडे खा रहा हूँ या खा रही हूँ तब मुझे प्रॉब्लम हो रही है, तो व्हेन वी गो एंड डिस्कस इट विद द डॉक्टर वी कैन टेल, इसी ऑब्वियसली अंडा जब जब खाया तब प्रॉब्लम हुई, बट अदरवाइज अगर नहीं पता चल पा रहा है, एग्जैक्टली नहीं पता है, is there any way where we can keep a track or jot down what we have eaten or what was our daily routine whenever we had a problem, for those who never had it but is having it now?
It can happen कि पहले आपको नहीं था, then suddenly you develop allergy to certain food items. So a lot of changes are going on in our body. So it can happen. It's a very normal situation, and it's very good if the patient can keep a record of the food items that are allergic to him or her. But if the patient doesn't know about the allergen, or if the doctor also not able to find out from the history, then we can also do some allergy tests. Allergy tests are also there in the labs, so we can go for those tests also to find out the particular reason or the particular food allergen.
Fair enough. We have Sanya Ahuja with us. She has a question. I had a case of urticaria causing hives from a very small age. I still have some minor symptoms. The issue here is, can I take my COVID-19 vaccination dose with this medical condition, since this disease is related to immune system? Do they really take screening tests before administering vaccines?
COVID as such can lead to urticaria. Some patients experience urticaria during the infection, early period of the COVID infection. Some may experience it for months after the COVID infection, afterwards also. And about the COVID vaccination, if you have acute urticaria or acute symptoms of urticaria, then in my opinion, you should avoid taking the vaccine. But if you but if your urticaria is controlled and now I mean the severity of the attacks has reduced, then you can take. In mild disease, I don't think so there's any problem in taking the COVID vaccination.
Okay. And you also mentioned about COVID leading to urticaria, and many people did complain that, when I had COVID positive, when I turned COVID positive, I had hives on my face, etc. और इनफैक्ट कई लोग तो कहते हैं कि हाइव्स हुआ या अर्टिकेरिया हुआ, उसके बाद पता चला कि कोविड पॉजिटिव हैं. तो व्हाट इज द कोरिलेशन बिटवीन कोविड एंड हाइव्स और अर्टिकेरिया?
बाद में आप सही कह रहे हो. Few individuals, they get to know about the COVID after the urticaria, because urticaria is one of the very common symptom of urticaria. And it can be related to the infection, or it can be related to the alteration, some alteration in the immunity, as COVID has a huge impact on our immune system. So it can be related to that also. But yeah, definitely COVID is related to the urticaria, not in everyone, but in some individuals it can be related.
लेकिन वो मोस्टली acute ही रहे, right? वो लंबे समय तक नहीं रहे और जल्दी ठीक भी हो गए.
नहीं, acute भी हो सकता है. If in some individuals it can occur in early period of the infection, but in some individuals it can continue for months afterwards. Once the acute infection or COVID infection is over, उसके बाद भी वो रहता है. COVID can lead to chronic urticaria also in some cases. तो दोनों ही कर सकता है.
Right. सानिया अरोरा हमारे साथ हैं, पूछ रही हैं, I get urticarial rash every alternate day. The rash starts slowly and spreads all over my body, including my head. It is really itchy, big round bumps form. I have to take steroid injections to get rid of this. It's been there since more than 2 years. I tried all medicines. Is there any permanent treatment, doctor?
अगर उनको डेली बेसिस पर हो रहा है और 2 साल से हो रहा है, तो इट मीन्स वो क्रॉनिक अर्टिकेरिया है. और आई होप जहाँ से भी वो ट्रीटमेंट ले रही है, डॉक्टर ने इन्वेस्टिगेशन सब करवाया ही होगा. आई थिंक कुछ रूल आउट नहीं हुआ होगा. और अगर जिन केसेस में कुछ कॉज हम आइडेंटिफाई नहीं कर पाते, व्हेन देयर इज नो कॉज और देयर इज नो पॉजिटिव फैक्टर और पर्टिकुलर etiology, then we call it chronic idiopathic or chronic spontaneous urticaria. So in that case, she has to take anti-allergic medicines on little regular basis, and she can also take a short course of steroid by a doctor, by a dermatologist. And if the symptoms are not controlled by the short course of steroids and anti-allergic medicine, then the doctor can also increase the dose of the anti-allergic medicines. So we call it up dosing. We can also add some other antihistamine, the second antihistamine, or if doctor thinks that the urticaria is associated with some autoimmune disease, or it has something to do with the immune system, then the doctor can also start with the immunosuppressants. So these are the few things that can be done by the dermatologist. If the cause is not identifiable, only then this can be done. And if the cause is identifiable, then the best treatment is to treat the cause or the underlying condition.
Fair enough. We have Namrata Arvind asking, मैम क्या अर्टिकेरिया जानलेवा बीमारी है? अगर डॉक्टर को न दिखा पाए तो क्या अर्टिकेरिया डेंजरस हो सकता है?
Urticaria is a benign problem, but as I mentioned that it's always better to consult a doctor. Why to suffer if you can consult a doctor and you can take very safe medicines? So why to suffer from the symptoms? You can, even if the symptoms are mild, you can always take medicines to relieve the symptoms, to relieve the itching. And about the dangerous part, then again, if it involves internal organs, if it leads to anaphylaxis, if it leads to angioedema, if it is associated with the angioedema, with the angioedema of the internal organs, then definitely it's a dangerous condition.
Right. तो इसीलिए नम्रता, एक बार हो सकता है आप किन्हीं वजहों से डॉक्टर के पास नहीं जा पा रही हूँ, लेकिन बार बार ऐसा कोई पॉसिबल नहीं है. तो इन केस प्रॉब्लम है, प्लीज गो एंड कंसल्ट द राइट पर्सन व्हिच इज अ क्वालिफाइड डर्मेटोलॉजिस्ट इन दिस केस. सलोनी मेहरा पूछ रही हैं, आई हैव बीन डायग्नोज्ड फॉर chronic urticaria in a treatment taking medicines for more than 1 year. Itching became a big problem for me. Is there a permanent cure? I think everybody with chronic urticaria is so, in a way distressed and asking again and again, is there a permanent cure?
Permanent as such depends from person to person. Some people respond to a very short course of medicine. Some take months or years to respond. Some has to take medicines for many years. So permanency has a different the definition of permanence is different in different patient in case of urticaria.
राइट. लेकिन जो भी क्रॉनिक अर्टिकेरिया के पेशेंट्स हैं, अगर वो सही से ट्रीटमेंट ले तो थोड़ा रिलीफ तो मिल ही सकता है. मतलब वो पूरी तरह से ठीक ना हो, पर या आप ना जाने की कब ठीक होगा, लेकिन रिलीफ तो आपको देगा ही. तो आई एम श्योर सलोनी आप अपना ट्रीटमेंट जारी रख रही हैं, सही से जारी रखें. कई बार ये भी होता है, कई पेशेंट्स अर्टिकेरिया के क्या करते हैं कि वो गए, उन्होंने इलाज कराया, कुछ महीनों बाद जब उनको आराम मिलने लगे, क्रॉनिक अर्टिकेरिया की मैं बात कर रही हूँ, तो वो डॉक्टर ने भले ही बोला हो कि और 1 महीने आपको मेडिसिन लेनी है, लेकिन वो वहीं स्टॉप कर देते हैं क्योंकि आराम मिल गया है. फिर हो सकता है 1-2 महीने बाद फिर उनको प्रॉब्लम हो रही हो, तो फिर वो सेम प्रिस्क्रिप्शन लेकर जाते हैं, फिर से दवाइयां ले आते हैं बिना डॉक्टर से सलाह लिए, और फिर से वो ट्रीटमेंट अपने आप ही शुरू कर देते हैं. फिर आराम होता है, फिर चले जाते हैं. तो आई एम श्योर आपने भी कई ऐसे पेशेंट्स देखे होंगे जो इस तरह से करते हैं. वो कितना सही या गलत हो सकता है?
नहीं, ये सही तो नहीं है. जो हम मेडिसिन देते हैं तो हम अकॉर्डिंग टू सिम्टम्स देते हैं, हम उस डोज पे देते हैं. उसके बाद जैसे जैसे सिम्टम्स कम होते हैं हम उस डोज को टेपर करते हैं, और फिर हम टेपर करने के बाद उसको बंद करने की भी कोशिश करते हैं. अगर पेशेंट के सिम्टम्स वापस नहीं आ रहे हैं देन वेल एंड गुड, हम बंद ही रखेंगे उसको. लेकिन इन केस अगर सिम्टम्स आ रहे हैं तो हमें एक मिनिमम डोज पे पेशेंट को रखना होगा एटलीस्ट फॉर सम टाइम. So one should never discontinue the medicine suddenly or on its own.
एग्जैक्टली कई लोगों को, जैसा हम बार बार बात कर रहे हैं, फूड से एलर्जी होती है, सर्टन फूड आइटम से या दवाइयों से कई लोगों को एलर्जी होती है, बहुत तमाम दूसरी चीजों से, पोलन से एलर्जी होती है, एक्सेसिव हीट या कोल्ड हो तो उससे दिक्कत होती है, और अर्टिकेरिया की वजह ये सब एलर्जीज बढ़ती है। ऐसे में क्या ये भी जरूरी है, क्योंकि खासकर मेडिसिन के केस में ये होता है, मान लीजिए मैं एक सर्टन मेडिसिन से मुझे एलर्जी है, लेकिन वो ना मुझे तो पता है और किसी को नहीं पता कि मुझे इससे एलर्जी है या नहीं। तो ऐसे में अगर मैं कभी इस स्टेट में ही ना रहूं कि मैं बता पाऊं कि मुझे इससे एलर्जी है, तो हो सकता है मुझे वो ड्रग दे दिया जाए। तो क्या अपनी फैमिली को, अपने फैमिली डॉक्टर को, या अपने वॉलेट में जैसे हम अपने आई कार्ड्स रखते हैं ना कि इन केस ऑफ इमरजेंसी कोई हमारे आई कार्ड्स देख लेगा, तो क्या वहां पे भी ये मेंशन करना बहुत जरूरी है कि हमको किस ड्रग से एलर्जी है?
Yeah, definitely. Family of the patient and friends of the patient should always be informed about the medicines that is prone to develop allergy and that is known to develop allergy to the patient. And in case of children, the school teachers or school staff should also be aware about that medicine or about that particular food item that the patient may develop allergy.
ओके, संतोष सिंह, ये जो सवाल है लगातार इस पर हम बात भी कर रहे हैं, सवाल है, कैन आई यूज ओवर द काउंटर मेडिकेशन और डू आई नीड अ प्रिस्क्रिप्शन ड्रग?
Definitely, prescription is always a superior option than the over-the-counter medication. Not in urticaria, but also in other diseases. Over-the-counter medicine should always be avoided, always. So it's not only with the urticaria, but with other diseases also.
एग्जैक्टली, तो ओवर द काउंटर मेडिकेशन एनीवेज हमें अवॉइड करना है। बहुत सारी कंट्रीज में ये पॉसिबल ही नहीं होता, आप जाके केमिस्ट शॉप से दवाइयां नहीं खरीद सकते हैं, डॉक्टर से ही अपॉइंटमेंट बहुत मुश्किल हो जाता है। लेकिन हमारे पास चूंकि एक लेवरेज है, बहुत आसान हो जाता है हमारे लिए, तो हम इसको मिसयूज में भी करने लगते हैं। प्लीज डोंट गो बाय व्हाट द इन्फ्लुएंसर्स आर सेइंग और व्हाट यू नो इज देयर इन योर किचन दैट यू कैन अप्लाई, और व्हाट योर फ्रेंड हैव डन, or what the over the counter chemist is asking you to do. Just invest your time, energy, everything in going and meeting the right person, the right doctor, a qualified dermatologist in this case, and don't risk with your health, क्योंकि ultimately आप over the counter medication करें, home remedy करें, किसी से पूछ के खुद का इलाज खुद करने की कोशिश करेंगे, तो रिस्क सिर्फ आपका है और किसी का नहीं। तो it's not worth taking the risk for your life. So go and consult the qualified dermatologist. And doctor, before we bind up, any takeaway message for our viewers?
Urticaria is a very, very common skin condition. It has nothing to worry about. Though the symptoms are worrisome, but as such, in most of the cases, disease is benign. And in most of the cases, it is due to the allergy of some very common food items or some medications or the insect bite or some infections. So in all the cases, the patient should always consult the specialist or a qualified dermatologist to find out the cause, because cause identification is very, very important in urticaria. And even if it is a chronic urticaria, in that case, it can be associated with some other disease or underlying diseases like rheumatological conditions and certain chronic infections and some other diseases also. So in that case, so it is very important to find out the underlying disease. And it's a good thing that urticaria is giving you a warning sign of some internal disease, and with the help of that warning sign we'll be able to diagnose a internal condition or some maybe more serious condition. So in the end I can say that one should always consult a doctor, should never try to do self medication, should never go for the over the counter medications. So this is my final messages to all the patients of urticaria.
That was a very important information that you just started, and I'm sure our viewers are going to, use it in a positive way. Thank you so very much, Dr. Bhavna Bhuraria, for your
Thank you.
valuable time. It has been a very informative session for our viewers, and I'm sure, they'll use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, at least now they know that instead of self-medication, it's always better to approach a nearby qualified dermatologist. Again, it was great to hear you, and we really look forward for many more such sessions in coming times with you for our viewers. Thank you very much once again.
I'm also very obliged to teach the general public or patients about the urticaria, and it's a very good platform to create awareness among the patients and among the general public. So, a very nice initiative.
Thank you so very much. It was a pleasure having you. Have a great day ahead, Dr.
Thank
Bhavna. And viewers, thank you for your participation in today's session. And to get the latest updates on how to keep your skin healthy, do like and follow our FB page all about skin allergy. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a great day ahead. Goodbye.